Panel. And if the members of the panel and our moderator could go ahead and come on up now and take your seats. I'm going to introduce them. Make sure that we have everybody, and I believe one of our attendees is going to be via Zoom. So are we good to go with our connection from Mr. Bennett? Well, while we're working on that, I'm going to begin with the introduction of who we have on our panel. And I will tell you, you've all been to an event where people are introduced and you are asked to wait until the person is completely done and withhold your applause till then. I'm going to ask you not to do that. I want you to applaud when we're done, because the fact of the matter is you've already experienced some amazing and dynamic speakers, and we as a planning committee have brought together some of the highest quality speakers and representation from across the state, and it's worthy of applause. So when I'm done, don't hold back and welcome our speakers to today's panel. I will start with Representative Brenda Landwehr, serving as a state representative from the 91st Judicial District since 1994. Representative Landwehr is actively involved with her family, her faith, and her community, whether it's as a Little League coach or working with the Salvation Army. Representative Landwehr has also served on joint mental advisory boards and is currently the chairperson of the Special Committee on Mental Health Modernization and Reform. And I can tell you, as an ad hoc member of that committee, I have seen Representative Landwehr's leadership in action in this arena, and I will tell you that Representative Landwehr's leadership in government in Kansas is one to be commended. So please welcome to our stage Representative Brenda Landwehr. Appearing on our panel today is Judge Mike Russell from Wyandotte County. He has served as a district court judge there since 2012, after previously working as a prosecuting attorney for 24 years. After completing his undergraduate work at Texas Tech and then law school at the University of Kansas, continuing the Big 12 theme, he now practices and now presides over in Wyandotte County District Court. In addition to handling a criminal docket, Judge Russell has established a behavioral treatment court in Wyandotte County for post-sentence defendants. And I will tell you, if you haven't observed this, if you haven't talked to Judge Russell, do so. I've been there. I've seen this behavioral treatment court. This is innovative, this is effective, and if you have any questions about what a behavioral treatment court looks like, I would encourage you to reach out to Judge Russell, because it's happening in Wyandotte County, and it's been happening since 2017. So please join me in welcoming Judge Mike Russell. We also have with us Dr. Shauna Wright. She serves as the Associate Director for the University of Kansas Center for Telemedicine and Telehealth, holds a faculty position within the Department of Psychiatry and Behavioral Sciences at the University of Kansas Medical Center. So she started her professional career at the Southeast Kansas Mental Health Center, but I'll tell you something unique about Dr. Wright that I learned in this process. Dr. Wright was actually a co-responder in college before we called it a co-responder. She was attending Texas Tech University, and she joined, and I want to make sure I get the title right, the Lubbock Police Department Victim Services Crisis Team. So it was a longer name then, but she was serving as a co-responder many years ago and has taken that experience, that real-world experience as a co-responder in Lubbock, Texas, to her job today. She also serves on the Governor's Behavioral Health Services Council as the subcommittee chair for the Rural and Frontier Subcommittee. Ladies and gentlemen, please welcome to our stage Dr. Shauna Wright. And I will just ask, because I don't see yet, do we have Mr. Bennett? Oh, there. Mr. Bennett, hello. I see you now. We also have joining us remotely, Mark Bennett, District Attorney for Sedgwick County. After graduating Kansas State University in Washburn Law, he served as a Deputy District Attorney for 15 years before being elected to the position of District Attorney in 2012, and he has served there since. Mr. Bennett is the chair of the Criminal Justice Reform Committee here in Kansas, has also served on the Mental Health and Substance Abuse Coalition. Mr. Bennett was named Prosecutor of the Year in 2018 and has presented on a variety of subjects and topics on criminal justice reform in Kansas and nationally. So, and I hope you can hear this, Mr. Bennett, but please join us in welcoming Mr. Bennett to our panel today. At this point, I am now going to turn it over to our moderator, Patty Tobias. Before she comes up here, I will let you know that Patty has been with the National Center for State Courts Court Consulting Services Division as a principal court management consultant since August of 2014. Ms. Tobias has experience working in a wide variety of national, statewide, and local projects, including those involving leadership, governance, case flow management, strategic planning, child welfare, and criminal justice system. She works with the national court organizations and often presents at the state and national conferences. As part of the National Center for State Courts team, she currently supports the work of the National Judicial Task Force that we've been referencing throughout the morning on addressing the court and the community's response to the issue of mental illness. Prior to serving in that role with the National Center for State Courts, she always worked as director of Idaho courts for over 20 years and also worked for the state of Missouri in court administration. She has won the NCSC Warren Berger Award for Administrative Excellence in 2012, among many other awards. And I will tell you that over the last 2.5 years, I've had the privilege of getting to know Ms. Tobias in helping to plan this event. Patty has helped us as a state, as a planning committee, plan this in conjunction with the national initiative. And I can tell you that her passion for improving this system is unmatched among her peers or anyone that I've met. So with that, please welcome your moderator, Patty Tobias.
Judge Wyandotte got that right. This is my passion, but I have met my match in Judge Wyandotte for Kansas. You guys are so lucky. It is such a privilege to be here with all three branches of government kicking off this important event. It's been my privilege to work with the Kansas team when they attended the regional summit. We held two. We got to the West and the Midwest in 2019, and then we had that little COVID thing. And so now we're back in the saddle, and we're going to the Southern region next week in Austin, and then we're going to the New England region the next month, and followed by the Mid-Atlantic region in June. And we're very excited to get the rest of the nation as excited as Kansas is, because this work takes the federal government, it takes state by state and community by community, and that's exactly what you're doing today and tomorrow, and I'm so excited for you. This panel, I'm also excited for this panel because you're going to learn what Chief Lukert and Judge Wyandotte talked about at the very beginning in their opening remarks. They came back from the regional summit wanting to learn more about what Kansas is doing already in this area and how can we as the state courts contribute to this work. So today, this panel will share with you what is going on in Kansas in this area, and I'm so excited. We also have three branches of government on this panel. So we'll not only talk, so here's the plan. We'll take 2 minutes apiece. They don't know I've got my timer with me to just orient you to who we have on our panel. And then we're gonna try to have a conversation. Followed by, we will leave plenty of time. Judge Wyandotte promised me he'll stand right in front of me and say, it's time to invite your questions of our panelists. And where'd Mark go? Did we lose him?
He's right here.
Oh, there he is, sorry. Of all of our panelists, sorry, I missed you there for a second. So in any event, 2 minutes. I'm going to put the 2 minute timer on just to have each of our panelists introduce themselves, talk about, again, in 2 minutes, what their main area of focus has been, and then we'll begin the conversation. So I am well-trained in matters of 3 branches of government. I always lead with my legislator. So if I could start with you, Representative Landwehr, you've got 2 minutes to tell us all about yourself and why you've been invited to be on this panel.
Well, first of all, I want to thank everybody that's here and everyone that's participating on Zoom. It was quite an honor when I got a call from the Chief Justice asking me to participate in this. And I said, well, I've got an invitation for you. And that's like, we want the judicial branch to join our modern health, mental health committee. This is not something I do in my private life whatsoever. I'm not a health professional at all. I've just been very fortunate to be on the right committees, I think, at the right time. I left the legislature for 4 years in the 2012 election, came back in 2017, have got to chair the Social Services Budget Committee, which is something very dear to my heart because you get to see everything in the world, everything in the budgets of the social services programs as well as their funding. The next term, the speaker allowed me to become chair of the Health and Human Services Committee. And I have been able to affect the budget since I've been back because we'd seen the community mental health centers had been cut almost in half, and we didn't think that that was right. So we found money and started bringing them back up to the levels they belong. With the help of the speaker, he had a brainstorm of, maybe we need a committee. And so we put together this mental health modernization committee, and it has done great work the last couple of years. Judge Wyandotte was one of our many individuals that participated in that. We hope to carry that forward this next year because it brings all levels of individuals that work with the folks out there dealing with this mental health disease. So I've also served on the Appropriations Committee, so I do have impact on the budget as well. I chair the CanCare Oversight Committee, which is the Medicaid committee for the state. So if you've got complaints, don't call me, just call my staff. They'll be happy to put you on the agenda because that's our job, is to help solve the problems that we have out there. So, and I am also a member of the K-12 Budget Committee. So it's a great privilege to be a representative and have the opportunities that I've had and get to work with some of the most vulnerable folks in this state. And my goal is to put Kansas back on the map where it belongs, in a better place with mental health. We used to really be there, especially when the Meniger Clinic was here in town, and we kind of lost a lot of that when Menigers moved to Texas. We also lost our workforce, so that's another area that I do a great deal of work on is, what qualifications and licensing and different things. In fact, I was texting with the BSRB just a little bit ago as how can we, what different things that we need to make changes on. So that's kind of a brief synopsis, and
Thank you.
I'll be happy to answer questions.
You met your time, and I'm really excited to learn more about your committee. So thank you. Dr. Wright, will you share a little bit about what areas you're involved in?
Sure. I am not originally from Kansas, but I started my career as a licensed psychologist in Southeast Kansas with the Community Mental Health Center there. Through that, as a member of the National Health Service Corps, I developed a deep passion for providing services to rural and underserved areas. And we are rural and we are underserved, and we're not a frontier county in Kansas. We'll talk about that in a little bit. But like other areas in rural Kansas, it's hard to do a lot of career development. So I started studying telehealth way before the pandemic. I actually launched an independent telehealth practice before there was even telehealth law in the state of Kansas. So kind of working on the frontier there. And through my work with that, I started reaching into frontier areas of the state and really got a sense for what our citizens are facing, not having access to the care that they need, the behavioral health care that they need. Through my telehealth work, I became associated with the KU Center for Telemedicine. I'm now the Associate Director of the Center for Telemedicine and Telehealth. And I served with the Governor's Behavioral Health Services Planning Council last year. For 2021, I was the chair of the Rural and Frontier Subcommittee. And with that work, we reach across and try to connect with a variety of coalitions, committees that really try to advance access to quality behavioral health care in the state of Kansas, regardless of your geography. And we look at all different populations and different needs. So I have a lot of passions being adopted into Kansas, primarily rural and underserved areas, and really leveraging telehealth. Now that everyone can do it and stand it up, that's great, but we need to fine tune that and make sure that our resources are getting to the right place in the right time, because we're still very underserved throughout the state.
Thank you so much, Dr. Wright. Mark, I'm going to go to you. Can you share a few things about the work that you've been doing with the Criminal Justice Commission?
Sure. The Criminal Justice Reform Commission was a product of the state legislature, who asked a group of professionals from a whole myriad of professions that touch the criminal justice system to come together to try to identify issues that needed to be addressed to make the system more just and equitable and also, frankly, efficient. One of the things I think, learned, if I had one takeaway, overarching takeaway, had to do with stabilizing factors that we identified, that were identified to us: employment, housing, and access to, we'll say, treatment, whether that's mental health treatment, drug and alcohol treatment, or treatment for an illness. If you have those three things, a stable place to live, a stable place to work, and access to whatever you need, whatever remedy you need, then your likelihood of being successful and staying out of the criminal justice system go up. If any of those things are not available to you, it's going to be exponentially harder to stay out of trouble and get, not violate probation and parole and that sort of thing. So there are lengthy reports from the Reform Commission in both 2020 and 2021 that identify a host of issues that we can address as a state, highly summarized. We were looking for things that could allow more robust access to diversion, working on traffic court, which may seem collateral to a mental health summit, but Kansas is not known for its public transport. So if you don't have access to a set of wheels or a way to drive them legally, your ability to get to and from work, your ability to get to and from treatment, and to get, to where you need to be is highly impacted. And so ways to try to address some 200,000 people, I believe, in the state of Kansas who have a suspended license right now. Consolidation of supervision. A lot of people who are in trouble in multiple places: city court, county court, next door county, another little city within the county. And when you're on probation to 3 and 4 and 5 different places, again, your likelihood of being successful is going to be highly diminished, especially if you're someone laboring with either mental health or substance abuse issues. So ways to consolidate that across jurisdictional consolidation was a big topic of discussion. Data sharing, so that we can do a better job of understanding exactly what's going on statewide and how we can leverage that information for cost avoidance studies, that sort of thing. Occupational licensing, things that would inhibit somebody from getting a job in their chosen profession. Those are just some of the highlights. There's lots more, but in 2 minutes, I'll keep it to that. But the idea was to identify the issues, make substantive recommendations to the legislature, and identify issues for future legislators to take up.
Thank you, Mark. Really appreciate that summary. Judge, 2 minutes. And he promised me he was an introvert and,
I am.
not a talker.
Well, first of all, last summer, Judge Bonnell called me and asked me if I'd be part of this summit. And I do appreciate that opportunity to be part of it and to discuss the mental health issues in our criminal justice system. It is a very important issue, as all of you know. For those of you who don't know me, I do preside over the Wyandotte County Beaver Health Court. We call it BHC. It began in October of 2017. It is a collaborative effort. The team of our BHC includes the Wyandotte County District Court, the Wyandotte County Community Corrections, the Wyandotte County District Attorney's Office, the Wyandotte Behavioral Health Network, which is our local community mental health center, Mirror Incorporated, which is a substance abuse treatment provider, members of the Defense Bar, and the Wyandotte County Sheriff's Department. As Judge Bonnell said, it is a post-sentencing behavioral health court. So the participants in this court have been sentenced. They've received a sentence. It is limited to residents of Wyandotte County who are over 18 years of age they've been diagnosed with a severe and persistent mental illness. They must be on felony probation, as I said, and they are considered to be high risk, high needs. Our goals in this program, like many goals for any specialty court, is to identify and address those persons in the criminal justice system who suffer from SPMI. It is to develop individualized treatment plans for the participants, to connect them to community treatment services such as mental health treatment, substance abuse treatment. It is to reduce their time spent in the criminal justice system, to reduce recidivism and to protect public safety. And we utilize evidence-based practices to do so. So that's kind of an overview of what my court is, or what we do.
Thank you so much. And my 2 minutes, I'll again cede to the group, to the panel, but I just wanted to mention, as part of the work of the National Judicial Task Force to examine the state court's response to mental illness, we've learned, and you know this, mental illness impacts all of our court dockets, it impacts all of our communities, it impacts all of our families, it impacts all of our friends and neighbors. It is pervasive, and we need to do better. Chief Justice Lukert this morning asked us to look for better solutions, and this is the exact panel that will kick off and continue that discussion. So with that, looking for better solutions through communication, collaboration, and coordination. Again, I always defer to my representative Landwehr. Kick it off, please. Tell us what you've done to improve mental health services to our state, or to the state of Kansas, and what do you see upcoming, okay?
Well, probably one of the biggest things that we had in changing mental health in the last 30 years will be changing our community mental health centers to certified
Community
behavioral health
clinics.
centers.
Yeah.
I'm still getting used to that extra C. Acronyms are not supposed to have 5 letters. So our CCBHCs. The good thing about this is we've had, our surrounding states have had these. We lose staff to Missouri and to Oklahoma because they can pay more for their social workers, and the reimbursement rates that our CMHCs have been receiving the last several years does not adequately cover the needs of the communities. The other thing is then they will receive what would be at a cost basis instead of just the reimbursement rate that the state pays. So that's very, very exciting piece. Then we have here a few years ago, we started the K-12 mental health pilot program. It's still a pilot because we're still figuring out how we can work it into the budget, but it provides mental health services for our children in the school building during the day, and then even when school is closed. I got to talking to a social worker one time in a school, and all I kept hearing was disconnect, disconnect. That child didn't have services after he or she went home, or on the weekend, or when a crisis happens. And that's right, it doesn't happen during the day. It happens at 10 o'clock or midnight on the worst day of the week. The upcoming piece that we have, and we're hoping that the Senate will pass this here when we go back into session the latter part of this month, is the new suicide prevention hotline 988. And the exciting thing about this is the federal government, even though they sent us down this unfunded mandate, they also said that we could provide services with that, and would have to provide services. So we are very excited to look at having mobile crisis units that can be dispatched. That could be a social worker, that could be a medical professional, or it could be law enforcement, or it could be all three. It just depends on what the situation is. The phones will be answered by licensed health professionals or mental health professionals. And hopefully it'll be a matter of a phone conversation versus having to dispatch anyone. The other thing that's really great about this is that everyone that calls that line, we are required to follow up and make sure that they got the required services they needed. And if they didn't, we're going to figure out how we make it work. So I think that's real exciting. And these mobile crisis units will also be in our rural areas. The problem there, the only problem we have there, but for Western Kansas, you're used to driving, is we will be within an hour of being able to dispatch one. So it's kind of an exciting time, I think, for us to have this come on, and this will go into effect on July 16 of this year.
I thank you so much. I want to emphasize each of those three areas. The certified community behavioral health clinics, there is a ton of money coming from the federal government right now. I mean, there's an open application process. There are resources out on our website that have been developed by the National Judicial Task Force on certified community behavioral health clinics. But Kansas has a wonderful opportunity, like right now. I think they're due, you know, the additional funding is due in May sometime. So again, take a look at that. That's great news. Representative Landwehr, your focus on K-12 pilot program, it is wonderful. Like Judge Leifman mentioned, if he was going to start all over, he would start with the young people. And you know, just like we have a national mental health crisis, we have a youth mental health crisis. And this is an important area. So thank you for focusing on that. And I'm so glad that you mentioned the implementation of 988. That is a matter of national urgency. We all need to focus on it. We all need to get smarter about it. And so let me ask our other panelists, do any of the three of you are doing some work in that area of 988 or in the other areas that Representative Landwehr mentioned?
I'm serving on the 988 Coalition as a representative rural and frontier. And like Representative Landwehr mentioned, when we look at mobile crisis units, we have to look at how do we, mold into our rural and frontier areas as well. So we've been really excited with the work that the coalition is doing and getting us ready to go. July is going to be here before we know it. And there's going to be some hiccups and bumps in the roads. And we do know that as far as our rural communities, and I think even in our more urban communities, their existing crisis lines will continue to be there and be available as people start to learn and navigate the 988 system.
Mark, is your commission doing any work in this area?
On the subject of 988, the subject of suicide prevention certainly came up. I think it's more specific in the criminal justice arena in the context of co-responder programs. So you make the call, you're seeking help. Maybe it's just a matter of speaking to somebody on the phone in a crisis moment, but maybe someone needs to respond. And we've tried to highlight the benefit of co-responder programs, both in Topeka and Wichita, the need to expand that statewide, also to have some degree of uniformity to them. What is a co-responder program? We probably need to define that more specifically. But then to the point that's been made earlier, how do you adequately fund that when social workers and the kind of folks who might be that co-responder can get paid better elsewhere, especially when you're close to a state line, maybe they cross the state line to a better job. So all part of that larger discussion.
Thank you very much. Judge, are you aware of or involved in your community at all in the implementation of 988?
I was not, but I'm excited to hear that that's something that's coming down in
Yeah.
July. But no.
Great. Representative Landwehr.
Well, I just thought I'd add is that in that legislation, we do have an advisory committee because Mark Bennett is right. We have to have some consistency, so those things will be laid out. We also have, and I didn't mention earlier, is we have currently operating as 3 call centers in the state of Kansas. One is in Johnson County, one is in Sedgwick County, and then we have the national headquarters that has been in Lawrence for several years. Our goal is to have at least 1 more, if not 2. The 4th one would probably be Topeka.
Representative Landwehr, I obviously haven't reviewed your legislation, but I did want you to know that there has been some model national legislation in this area, which asks the Chief Justice of the state to appoint a representative from the judiciary on there. I don't know if you have that. I'll make sure you get that, so we get so we let the chief have an appointment on the big advisory committee, because it is going to take, like everything else, all 3 branches of government, local, communities, small rural communities, the metropolitan areas, et cetera. So I'll get you that legislation. Well, let's hear a little bit more about the Governor's Behavioral Health Planning Council. I would love to hear more about it.
Sure. Can we put the slide up? So I don't know if you all know, but the federal government requires all states to have a mental health planning and advisory committee. So here in Kansas, the Governor's Behavioral Health Planning Council serves that purpose. That council is made up of mental health consumers, their families, caregivers. It includes behavioral health providers, state agencies, as well as private citizens. And then beneath, the realm of that council, we have 10 subcommittees where we take targeted areas of identified need in the state, and we wrap our subcommittee members around those issues and try to advance the needs of each of these populations. And so when we think about, how can we leverage the individuals who serve on these subcommittees to advance the judicial work, there are many of these subcommittees that would love to be at the table here and would love to work with you. It's one of the reasons when Audra became available, we said, will you join our subcommittee? How can we leverage what you're doing throughout the state? And one of the things that we really appreciated about the Stepping Up initiative is that it's data driven and it's designed to fit the needs of the community rather than taking a one-size-fits-all approach, but to really look at local resources, local availability, and pull that all together. So there are many committees here, subcommittees that would fit in well and help in different areas of the initiatives that we see coming forth today, and partnering with the judiciary. And so if you're interested, please let me know. I'll connect you with the right people.
Yeah, that's quite an invitation if anybody's interested. There's again, that's a long list of varied opportunities. So thank you, Shauna. Has anybody on our panel had a chance to work with the Governor's Behavioral Health Council? No,
I have
not yet? Okay, well, we'll get you some collaboration and communication and coordination going on. Mark, I wonder if you could take a little more time
I don't listen to music anymore when I run, just for
to
safety.
share what's going on with the criminal justice.
Yeah, well, I
community,
always
which
run
is
into the direction
VC
of traffic for that reason, if I can too.
is sooner rather than later. Did I lose them?
I'm here.
Oh, there you are. Sorry, your picture faded.
Yeah.
In any event, Mark, if you could share a little
Yeah,
bit.
hang on one sec. I think Ariel Rhines, there we go. There, she got it. Okay, sorry, that was what was happening. Somebody else's mute was off. Sorry. If you wouldn't mind asking that question again.
Okay, thank you. Mark, I wondered if you would share a little bit more about what the Criminal Justice Commission is doing about the intersection with those with serious mental illness. We all know there are serious problems in that regard. We look forward to hearing some of your solutions or some of what you're learning through the process.
Sure. So obviously our focus was on the criminal justice system specifically. As we heard throughout the course of the day, the intersection between mental health and criminal justice is very robust. I mean, there's a lot of crossover, but we're trying to focus on pretty pragmatic, specific solutions to improve people's lives. And again, kind of with that overarching theme of stabilizing factors. So things like, I touched on them earlier, but we'll get a little more of a deep dive here. If you're somebody who's had brushes with the law and say, and we'll use Wichita, for example, I'm on probation in the city court, I'm on probation in the Derby City Court, I'm on probation in the county court, and maybe I got in trouble in Wellington and Sumner County as well. So now I'm seeing 4 POs. How do I do that when I also need a caseworker? I've had mental health issues, maybe I'm struggling with substance abuse issues. How do I do that successfully? I don't know that everybody recognizes, but pre-COVID even, over 2/3 of people who are convicted of felony offenses in Kansas are granted probation right off the bat. That's what I've always known. Being a prosecutor in Kansas, I didn't realize how unique that is. Well, we give probation a lot. The question is how many people end up in the prison system because they fail at probation. So trying to come up with ways to make if you're being placed on probation, is, if I'm a defense attorney, I've got a client with mental health issues. My goal is to get them on probation, get them into treatment, and then, hope for the best. Well, if they can't be successful in probation or parole later, then the likelihood that they'll end up in the penitentiary or go back to the penitentiary goes through the roof. So trying to address, again, these cross-jurisdictional consolidation, trying to come up with ways, something substantively simple, it may sound like, and maybe it seems mundane, but it's a big deal, is to allow parole officers have had the ability to issue a ID, a Kansas ID to their parolees for some time. Could we get court services and community corrections probation officers the same ability? Because it's very hard to get a job and a place to live and access to treatment, et cetera, if you don't even have a formal state ID. So some of these seem kind of mundane against the backdrop of this larger issue, but these sort of fundamental things that a person needs to get through the day are some of the issues we really try to address and tackle.
So, no, those are all very practical areas that are of concern, I'm sure, not only here in Kansas, but across the nation. As I've worked with other states and working with the National Task Force, the focus has really been on those kind of practical solutions that we need to look at, as well as some of the bigger issues that you mentioned. The competency to stand trial, Audra mentioned that this morning. Many states are experiencing serious problems. As Audra mentioned, we do have a national blueprint report on some of the strategies that many states are beginning to use to address it. The big deal is, rather than go the competency route, we need to be diverting individuals away from the criminal justice system into treatment before they enter the criminal justice system. But if they do enter the criminal justice system, are there ways to, again, divert before competency is raised? But if competency is raised, there are many efficiencies that can be considered and looked at. So that is an area that will require this sort of communication, collaboration, and continued work. We've also focused on the diversion areas. So I'm going to turn now to the judge to say, what kind of diversion efforts do you have underway? Your court now is post-sentencing, as I understand it. Are you looking at any pre-sentence diversion areas that you could examine?
Well, I want to go back and
Yes.
answer your question in a minute, but Mark brought up about people he placed on probation that are suffering from mental health. I mean, that's kind of how this whole court that I started, or we began in Wyandotte County, that's how it began, was when I took over a docket in 2012 conducting probation violation hearings. Defendants who had been placed on probation, but then they were alleged to have violated their probation conditions. I started to notice that a lot of them were coming before me and they appeared to have mental health issues, and yet they weren't able to comply. I mean, they weren't able to maintain jobs, stable housing, report substance abuse. A lot of them had co-occurring problems. And I started asking questions, and no one was really dealing with the issue.
Right.
I've been a prosecutor for 24 years, and I'll tell you that other than competency and mental defect, I don't know that I concerned myself with how much mental illness played a part in our criminal justice system. Now that I was a judge and I was having to make a decision, should they continue on probation? Should they go to prison? I had to deal with it, and that's kind of how our court, how it came into existence, was it became this effort with community corrections, and then with Wyandotte Center. I got a tour of all our resources in Wyandotte County. When Mark Dupree became the DA in Wyandotte County, he was very supportive of this program. So that's how our program began. You asked about diversion. The district attorney's office does have a mental health diversion program that they have. Now, it does not have any judicial oversight, but it kind of fills the gap where we are limited to having participants who are utilizing Wyandotte Mental Health Center services, or they are residents of Wyandotte County. Mr. Dupree's program, I think, is a lot broader in that they don't have to necessarily live in Wyandotte County, and they don't necessarily have to be a client of the Wyandotte Mental Health Center. So we do have programs like that. We also have our Veterans Treatment Program that I think somebody may have mentioned. And it has a diversion track of it. It also has a probation and a probation violation track. The district attorney's office has diversion for drug cases. We have our post-sentencing drug court, and they deal with mental health issues in that program too. So we do have several programs that we're addressing the mental health issues in Wyandotte County.
That's terrific. I think the goal is that all communities and all courts have that continuum of diversion programs. And so as you begin your work or continue your work in Kansas, we do have many resources that can help you really look at that continuum.
Well, with Audra coming in, I think we're going to have a site visit in June with the Stepping Up initiative. Our commissioners have adopted the resolution, so we are one of the 13 states, or 13 counties, sorry. But I think it's going to fill some gaps that we have in Wyandotte County. Try to figure out what gaps we have as far as identifying those in our jail system or coming into our criminal justice system with mental health issues. How do we address it? How do we, divert them to getting services?
It really is an advantage to have Audra here in Kansas. It's a unique position, so you guys should take advantage of it. We really encourage all counties to join the Stepping Up initiative and all courts to be involved. The jail and jail administrators can't do this alone. The judges have to be involved in this and really get engaged in that, reducing the number of individuals in our jails, because we control the progress of cases as they're going forward. We control the ability to divert to other opportunities or treatment programs that may be available. It's another example, Judge, of being engaged and really identifying the gaps. That's what's important. So thank you. Are you working at all, Dr. Wright? Are you working at all with your telehealth and telemedicine with our jails in Kansas? Or with the courts, are there opportunities to take advantage of what all you've learned?
I think there are opportunities. Prior to the pandemic, most of what I saw going on in Kansas were by private telehealth companies that would provide services. I'm not sure what the expansion has been into jails or prisons during the pandemic. There are some unique situations. I know that in Allen County, where the 31st Judicial District is, they have a drug court there. As a supplementary service, the Mental Health Center got a grant to provide telehealth services into the county jail specific to substance use disorder, so that if someone who was currently in service was incarcerated, that they would still have access to their care provider. And then the grant covered the cost of those services for the time that it existed. So I think there's a lot that can be done. I don't know if I can show one of my maps here real quick, but in terms of what's available, I don't know if we can pull that up.
Second slide.
Second slide. Yeah, let's see. Here we go. Oops, that's the third slide. Let's go back. When we look at the state, out of the 105 counties, 101 of them are underserved, meaning that we do not have enough behavioral health service providers in that county to meet the population that lives within that county. If we looked at this map in 2017, the Sedgwick County area would have been, the grade portion where part of the county had enough behavioral health service providers. Now in Sedgwick County, it's completely, the whole county is underserved. And so when we look at the providers who are available in the state and we look at what telehealth has to offer, telehealth doesn't increase our workforce. It may make it more accessible in terms of helping out and working with the courts and with the jails. But we still need to do things like partner with our community mental health centers, our CCBHCs, and telehealth can play a role in that, but it needs to be designed. Our providers in jails need to be trained to make that sustainable and efficient. And the other thing I would recommend with that is, we talk a lot about training others about mental or behavioral health, but there's a culture, right? There's a whole elephant that comes along with the legal system. And so our behavioral health providers need to learn that culture. They need to learn that elephant to really effectively provide those services. So telehealth is a tool in the belt, but there's a lot of training and cultural development that comes along with it for it to really be successful and sustainable.
Yep, thank you so much. Our Judge, do you have any telehealth in your community?
I'm sure I can answer that question. Off the top of my head, I'm trying to think. I think we're starting to use, I think we're competency. We're starting to use some of that.
Great.
I believe we do have telehealth, but I don't know how much in criminal justice system. I don't believe we're using much in telehealth.
Okay.
If Judge Lynch is here. I think she runs a care and treatment docket. I think she probably uses it more than anybody if there's anyone doing it.
Terrific. Mark, is this something that your commission has been looking at relating to those with mental illness?
Well, again, only in the respect of trying to make mental health access to a mental health treatment provider of some kind more accessible. We obviously, I'm in Sedgwick County, but have to be on notice that there's a lot of counties with needs that are different than the more urban areas. And when Sedgwick County is in the list of places with not enough mental health treatment providers, kind of tells you about the dire straits across the state. So yeah, it has been a discussion, not just though in telehealth as a discrete topic, but more in terms of it touching on lots of the issues that we have raised throughout the last couple of years on the commission. The need for someone to have more access, more ready access to a clinician, and I also say even to their lawyer. I mean, this is a tangential issue here, but if I need to see my lawyer, and I've been appointed a public defender, and I'm in a very small rural county, I have learned the frontier language as well, that we still have counties referred to as frontier. And my lawyer doesn't come to town again for another 6 weeks. If I am languishing because in jail, because part of my issue is mental health or substance abuse, etc., I may not see a lawyer physically for a month, not because they're doing anything wrong, because they're not available and they're elsewhere. And so the telehealth, access to, and fill in the blank, medical professionals, mental health professionals, substance abuse attorneys, etc. All of these were topics of discussion at one point or another during the course of the session.
Good work. Before we open it up for questions and answers, I would love each of our 4 panelists to let them give you their advice. They've been working in this area. What's 1 or 2 pieces of advice you'd like to share with our attendees? Representative Landwehr.
As I told you earlier, being in the healthcare industry is not my private sector life. So the work that I've been able to do has been because of people like you that have, made a call, talked about a situation, and we come up with solutions and we find out that others need it. So I would advise you to, don't hesitate to pick up that phone when you have a need, call your legislator. If you don't know who you should be talking to, call the chair of the respective committees, whether it's the Social Services Budget Chairman or the Health and Human Services, Public Health and Welfare on the Senate side, and Senate Ways and Means has a social services budget as well. So reach out, don't be bashful. You're the experts. That's one of the things that made the Mental Health Modernization Committee so successful, is because we had the experts at the table. And I might want to add one other thing is, if you want to see what that work is done, you can go onto the legislative website, look up that committee, and the report is online, and on the back of it, you'll also see a checklist of the things we wish to accomplish and what we have accomplished.
Oh, that's wonderful. We'll make sure that we get that to I was looking for Judge Wynell. We'll make sure we'll get that on the Summit website so everybody has really easy access. Dr. Wright, a piece of advice or 2.
I think it's that we don't have to reinvent the wheel, right? If there's a passion and a desire to move forward, it's about looking at systems that work and then tailoring them to your own community and your own needs. Now, I think about the great work that Representative Landwehr has done in the state, embedding behavioral health providers within the schools. And that can be done within the justice system as well. We can take the models that work and we can replicate it and we can make it fit our communities. So I think doing that needs assessment, being aware of what your community resources are as well as their needs, pulling in those stakeholders, and then not feeling like you have to take that and draft your own plan, but to connect with others who have done it to develop something that's successful.
And Judge, what would be your advice that you'd want to share with our audience?
Sure. If you are thinking about putting a specialty court in your jurisdiction, you've decided, you've done your studies and decided it's feasible and it's something you need in your community, I would suggest to you, when you are identifying your stakeholders, we did a good job identifying the stakeholders in the criminal justice system. They make up the team. What, if I had to do it over again, is identifying the stakeholders out in the community, in the state, who can help you with resources and provide, whether it's sustainability, which is funding, or whether it's the issues you're going to face, which are things like housing, if you have a big homeless population, have mental health issues, or jobs, or transportation, or stabilization issues. We have been able to address them with it, but if I were to do it over again, and I would spend a lot more time early on identifying those stakeholders and those resources in our community and in the state. And I agree with Ms. Wright. I wouldn't try to just reinvent. Got mental health courts here. There are last time I looked, there's over 400 mental health courts in the United States. SAMHSA has a great site called Gain Center. You can go on there. They have a map of the United States. You go on the state, you click on it, and they'll give you every mental health court they've identified. And you can go on there and get contact numbers. A lot of them have their websites, and you can get information. It'll really help you.
Good. All good advice. Mark, you get the last word on advice.
I guess I've been on a lot of committees on these subjects, whether it's criminal justice reform, mental health, or substance abuse, you name it. I think we need to be pragmatic. The notion that you can go to the legislature and say, I need $100 million for this in my county, and and these huge price tags, or go to Coke Industries or to some private sector and they'll simply write a check for it. Sounds good, but it's not likely to happen. Legislators are there to make sure that they are good stewards of the public resources, and increasing taxes, expanding financial obligations of the state is a real concern for them. And so we have to, instead of simply coming and saying, fix this with these big, huge omnibus plans, I think it is important for each of us to do what we can as we can. The judge, I was able to tune into some of this morning, the judge from Miami, he may have saved Miami-Dade County $96 million, but that wasn't because they gave him $96 million on the front end. He had to find workarounds and come up with collaborative efforts in his community to address things and give people the help they need. If you give prosecutors and defense attorneys and judges solutions in the community and that'll be viable, unless we're talking about murder cases and child rape or something, and most of it, all these other cases we're dealing with, we're looking for some equitable solution to prevent the person from coming back into the system and trying to make the victim whole as best we can. These are things that there are things we can do locally, and if we can continue to identify those and increase our efficiencies, then maybe some of the money will be available to take some of these larger steps at the statewide level in regional mental health centers, expanding Larned and Osawatomie and things like that. So.
I totally agree. I mean, we all believe that we can improve public safety. We can improve outcomes for individuals, and we can save costs if we get smarter, if we intervene earlier. if we intervene the first time and not the 10th time or the 12th time or the 20th time that we see so many individuals reappearing in our courts. So, Judge?
We are ready for question and answer. Again, if you are appearing via Zoom, go ahead and submit your questions in the chat. I've already received some of them that I will begin to address to our moderator and our panel, but you can go ahead and submit some additional questions now if you are joining us via Zoom. So I will walk around the room. Please hold up your hand if you have a question, but I will start with an online question, which is, as we discuss national and local initiatives, could anyone on the panel or the moderator give us a little more information regarding the K-12 or educational mental health pilot program?
That would be Representative Landwehr.
Well, the program, first of all, provides a liaison in any school building. Now, we talk about a district that has decided to join the program. It depends upon how many buildings that they've decided to put the program in. So we will have a liaison that currently the state will pay 50% of that individual's salary. It requires a bachelor's degree because that individual is responsible for helping identify the kids along with the teachers and coordinate with the community mental health center. Community mental health center then comes into the school. It may be group therapy, it may be individual therapy. There is also therapy that's offered after school. Some of our buildings are staying late, open late. One of the things that we didn't think about when we started with this program was what that meant to very small communities. And we all know that everybody knows everyone's business. And parents found out that they could show up at school in the late afternoon and no one knew what they were going to school for, and it might be mental health services. So it actually provides a true wraparound so that it involves the parents, because the issue that the child is dealing with and struggling with may be that mom or dad is out of a job, there's health issues, et cetera, going on at home. So how do we help get mom and dad some assistance and help and hopefully reduce the stress on the child?
And we have a question from our audience.
Judge Russell, could you address what happens to the charges after the probationer graduates from your program, for lack of a better term?
Well, they have a conviction, and with our program, they still have the conviction. Now, there is a bill, House Bill 2361, which I believe is before the governor for her review. If it is signed into law, a provision of that bill includes that if someone who successfully completes a specialty court, that if for certain crimes, not all crimes, so it's not going to cover murder, it's not going to sex offenses, it's basically that are severity level 6 through 10, theft, aggravated assaults, they can then petition a court for expungement of their conviction. And that will be, I think it will help with those that are post-sentencing specialty courts, that they will then have their, potentially for some that are in the programs, they will have their convictions expunged, which then will be a, obviously for them not having to report it except for under certain circumstances, jobs and employment. So we'll see if that passes.
And again, if you have a question in our live audience, raise your hand. I'll come around and allow you to address it to the panel. We do have another online question. Did I hear correctly, or do I understand that mobile units are going to be available within an hour for rural communities? Was there a comment about that, and can you expand?
On the 988 legislation, a mobile crisis unit, like I said, could be made up of law enforcement, healthcare provider, a mental health professional, or maybe just a mental health professional. 9 times out of 10, when a mental health professional has to be sent out, there'll probably be law enforcement that goes with them. We are not building buildings. We are not sitting out vehicles somewhere to wait for these calls to come in. It'll kind of be put together on the order of like a volunteer fire department. So these individuals have got day jobs that they're actually doing. But if they get a call and they have to move out on a mobile unit, they will be able to do so. We are required in the federal legislation to make sure that we are within 1 hour of being able to provide services. And that's where the crucial part comes in for our rural community.
And Representative Landwehr, are we also exploring technology with that for areas that could sustain it through 5G or other broadband? The possibility of even using tablets or other devices if there is a volunteer or an officer that would take a tablet out to do a quick crisis screening or assessment in response. I know that we had talked about that a little bit on the coalition. It's not anything that's been approved, but are we still entertaining the idea of leveraging technology in areas where it might take longer to get there, but we would have a volunteer that could get there with a tablet? Is that still on the table?
Well, it's on the table. It's not in this legislation. And, one of the reasons was there was a lot of pushback during the legislative session of the price tag for this program. We had originally started out with about a $17 million program. And that would have put a 50-cent charge on all phone systems and then there would also been a charge on prepaid phones as well. And then we got it down to 20 cents. There was still pushback. Well, because this year that we do have this big found money, and it's one-time money that we're dealing with right now, is this year we will actually fund it, and the request is at $10 million. I am hearing that the Senate is wanting to push back on that $10 million and not fund that. I think that that would be very disappointing and very sad for the peoples in their communities.
I'll just add that with the certified community behavioral health clinics, I know of some jurisdictions that use the method that you talked about, and that it can be partially funded through those certified community behavioral health clinics, where in some rural areas, the officer is responding, but has the tablet to communicate immediately with a behavioral health professional as needed. And so sometimes the clinics themselves can really be responsive and add to the services that are available in the community.
All right, and we have another question from our audience.
Judge Russell, I was just curious on your court, is it made as a condition of the probation or is it a voluntary program?
It is a voluntary program that I was talking to Judge Picorni over lunch. This House Bill 2361, if I'm reading it correctly, it will amend our sentencing statute to allow a judge to order a person put on probation to participate in a specialty court. But for now, ours is a voluntary program. So we've had some who have been referred to us when they find out how intensive our program is. They have chosen not to engage in that program, but it is a voluntary program.
So we have time for a couple more questions. Again, if you're in the audience and you have a question, please raise your hand. I will tell you that we have another online question for Representative Brenda Landwehr. First of all caps, thank you for being an all caps strong advocate for our 988 efforts. Question: what are your thoughts related to what we need to do to educate the community as it relates to the investment that is needed to support the 988 crisis line and the positive impact for mental health support and crisis response?
Wow. Well, and first of all, with the thank you, I appreciate that, but it's not something that I do by myself. And I do have to say that the mental health legislation that I've had the privilege to work on the last few years has truly been a bipartisan effort, and I appreciate that a lot. Senator Pat Petty is here with us today. She's been on this group here trying to organize this, and she does a lot of work over on the Senate side with things. So it's not just me. So the appreciation goes out for all those legislators that took the time to work on it. I think that, it's, as far as the communities, we're trying to get people to understand. I know I have a lot of conversations have had with my county commissioners. And one thing that they've done down there is they're really looking at how do we bring all of our mental health services together, because we're fragmented all over the city, and we may have a small organization that if they were to join up with 3 other organizations, not lose their anonymity, but be in one place, that we could make that money go a whole lot further. And also the fact that the communities do need to look at, stepping up to the plate. The state cannot handle the entire weight of dealing with the mental health issue. It does impact every one of our state budgets. It impacts every business in our community with tardies, absenteeism, less work productivity. And so I think that we're starting to see more people recognize that the stigmatism can go away. Let's help these people get some services. And it's going to take some money to take and do that, but it takes a lot of talking from the community. I know that's not the answer they probably wanted, but that's kind of the stages that we're at right now.
Before we conclude our panel today, are there any other questions from the audience? I will check one last time if we have any more questions in the Zoom room. I do not see any. Are there any more questions from our audience?
This is a quiet bunch, Judge. What's up with this?
Yes.
Judge, while you've told us about the benefits of the mental health and the people that you help and serve, what has been the benefit to your community? Has it been a cost savings, a time savings, through, stopping the revolving door?
I think, one, it is a revolving door. And so eventually they end up in our district court. They may have been over municipal court all this time. Now they end up in our district court because either they've reoffended a more serious felony at that point. I like to believe, and I haven't seen the figures yet, that we are saving the community money, because I believe our sheriff said it cost $94 a day. I believe the last figure I saw to house someone in our local jail. We also, I think, help the participant by offering them a lot of wraparound services. We are taking a very high needs, high risk participant, which is what Judge Leifman, I heard him say, that if you're going to do a post-sentencing, it needs to be that. Well, that's what we do. We don't take the easy ones. We've got the ones that are charged with some serious offenses, and we offer them a very intensive. If they're going to be on probation, we're going to give them the most intense services or supervision we can. And in doing so, we are offering them an opportunity to reconnect them to treatment services, to substance abuse treatment services, cognitive services, help them get IDs, help them get Social Security, disability. The team I work with, they go up and beyond what is required of them. I heard Mr. Bennett talk about having multiple cases in counties. We have that sometimes. And Zach Anthony, who's our defense attorney, he's working with those counties sometimes too, so that they don't get imprisoned over in that county, or they don't revoke them over there and send them to prison, as long as they're doing successful work, or they're doing successfully completing our program. So I think it is a cost savings, but I think more it's really to help the participant and realize that we cannot send everyone to prison. And so if we can help someone, then that's what we need to be doing in the criminal justice system. We have to address this.
Let's thank our panel one more time. Representative Landwehr, Judge Russell, Dr. Wright, Mark Bennett, and Patty Tobias. Thank you so much. Before we take you're welcome.